Hello, my name is Jessica Ferguson, and I'll be presenting for Group 2. Our research topic was mirror therapy efficacy in stroke survivors, and the purpose of our study was to determine the impacts of mirror therapy on activities of daily living in subjects who have experienced strokes. So mirror therapy is a type of rehabilitation approach where the reflection of a moving non-affected limb gives the illusion of movement in the affected limb. So basically tricking your mind into thinking the affected limb is moving. To move on to our hypothesis, our null hypothesis stated that there was no significant difference in the impacts of occupational therapy on activities of daily living in patients who have experienced stroke as measured by mirror therapy. For our method, we used 30 adult subjects, 15 were male and 15 were female, and all subjects were diagnosed with hemiplegic stroke and have upper limb hemiparesis. Our subjects were randomly separated into two groups, group 1 being mirror therapy and group 2 being our control group. Both of the groups received occupational therapy treatment 3 days a week for 4 weeks, and we used the box and block test to ensure validity, which the box and block test is a modest test to measure one-sided net manual ability in both groups. And this was done on both the less affected and most affected side of each subject. Our independent variable was mirror therapy, and our dependent variable was the box and block test. And our data was analyzed using SPSS. Moving on to our results, here we have a table, and the statistical procedure consisted of a one-way between groups ANOVA. Our p-value resulted in 0.287, and our alpha level was set to 0.05. Therefore, our null hypothesis was accepted, meaning that there was no significant difference between the mirror therapy and our control group. To conclude, based on the results of therapy used on patients who have experienced strokes, there was no significant difference between mirror therapy and sham therapy or a control group. Individuals before and after treatment for both groups numbers experienced no substantial rise or decline. The null hypothesis stating that there is no significant difference in the impacts of occupational therapy on activities of daily living in patients who have experienced strokes as measured by mirror therapy was accepted. Thank you.